Are painkillers really safe for long-term use? It's a question many of us have pondered. You have a headache after too much drinking, your back aches from another day hunched over a keyboard, that old shoulder injury is playing up again. What do? There's a good chance that you'll reach for the white pills in your medicine cabinet. Popping a painkiller has become a common practice worldwide. So much so that the sales of the over-the-counter painkillers have increased, especially post-COVID-19 pandemic. While they provide relief from discomfort, the safety of their long-term usage remains a topic of debate. Paracetamol is the workhorse painkiller. The global production capacity is 150 kilotons. It is widely viewed as cheap, safe and effective. China holds 59.02% and India holds 24.84% of the total global paracetamol API production, respectively. And their market share is increasing in recent years. Although the potentially fatal consequences of taking a paracetamol overdose are well known, the widespread belief has been that the drug is mild and relatively safe if taken at the recommended dose. But this is increasingly being questioned by scientists who say that taking it over prolonged periods can have serious side effects. Improper use or prolonged reliance on these drugs can lead to gastrointestinal complications, heart problems, liver damage, and kidney dysfunction. According to Harvard Health, non-steroidal anti-inflammatory drugs like aspirin and ibuprofen might seem like safe bets, but their long-term use can have potentially dangerous gastrointestinal side effects, including ulcers and bleeding. The treatment of mild and moderate pain can be relieved with OTC painkillers, but they shouldn't be used for more than a few days in a row, and the maximum specified daily dose should not be exceeded, that is 4 grams per day. In fact, a recent and a new study by University of Edinburgh has issued an alarming health warning to people who regularly take paracetamol. Let's quickly know what the study says. The researchers of this new study observed effects of taking paracetamol on mice and concluded that it causes liver damage, and this is the first time that a study has linked paracetamol toxicity to liver damage, which was similar to what's seen in conditions like hepatitis, cancer and cirrhosis. The pill that we are casually popping has been denied for overconsumption and too regularly. But how did it become an integral part of our lives? Paracetamol rose to prominence during the 1960s in the wake of fears that aspirin and other non-steroidal anti-inflammatory drugs such as ibuprofen could cause gastric bleeding, ulcers and other serious side effects. Some concerns were raised about the possibility that long-term use of paracetamol could also cause internal bleeding, but the evidence for that was mixed for many years. But in 2021, a rheumatologist at Nottingham University, Professor Michael Doughty, published a study looking at almost 90 patients aged 40 and older who took paracetamol, ibuprofen, or a combination of both for chronic knee pain. When he compared the participants after 13 weeks, it came as no surprise that 1 in 5 on ibuprofen lost the equivalent of a unit of blood through internal bleeding. What was surprising was that so too had the same proportion of patients who were taking paracetamol. And he concluded that paracetamol can actually be a very dangerous drug. The maximum 24-hour dose of paracetamol is 4 grams, but as little as 5 can cause liver complications, and it can be easy to overdose accidentally by taking more than one product containing it at the same time. Sometimes prolonged use of painkillers can affect the real diagnosis of the pain. Relying solely on OTC painkillers for long-term pain management can obscure underlying health conditions. Pain often serves as a signal of underlying issues, and masking it with medication might delay improper diagnosis and treatment, allowing potential ailments to worsen over time. If you look at asthma or diabetes, these are really well self-managed conditions because people are empowered and we are not used to the concept of self-management of pain. In fact, patients shouldn't be using paracetamol habitually. Rather, they should take them when they have the pain and when they are going to do something that normally provokes pain, such as going for a long walk. They should also consider other ways to manage pain such as hot baths and stretching exercises. So, always follow dosage instructions and avoid self-medicating without professional guidance. What you can do is explore alternative pain management techniques like exercise, physical therapy, or acupuncture. it may offer safer and long-term solutions. And do remember to dispose of expired or unused painkillers properly to prevent accidental ingestion, because your health is your wealth.